Good morning. We're 7.5 months into COVID-19 pandemic, and sadly, infections and death are accelerating in many parts of the world. There are now more than 21.5 million confirmed cases, and over 760,000 people have died. Each one an individual tragedy for their family and community. In our region, with the number of cases reported has been much smaller than other parts of the world. Each country is facing a different situation. And some countries that moved quickly to contain COVID-19 in the early months of the epidemic are now fighting new surges, in some cases larger than their initial outbreaks. I'll ask my colleague, Dr. Tamano Matsui, to provide an update on the key numbers in the region. Tamano, please.
Thank you, Dr. Kasai. Good morning. My name is Tamano Matsui. I'd like to summarize the current trends in COVID-19 for the Western Pacific region. To date, more than 400,000 cases have been reported in the region, and 9,293 have lost their lives to COVID-19, which represent 2.3% of all reported cases. The slide shows the trend in the number of reported cases of COVID-19 for countries and areas in the Western Pacific region from January until now. The vertical axis displays the number of daily cases, and the horizontal axis displays date of report. The colored bar represents the countries reporting those case numbers. As you can see, the early period of the pandemic in the region was characterized by a large outbreak in Hubei province, China, which was brought under control. After that, we saw reports of clusters outside of China, and then increasing levels of community transmission. Recently, we have observed increases in the level of community transmission in some countries, and early detection and response to large clusters in other countries. These patterns indicate that we are entering into a new phase of epidemic and response. This slide shows the trends in reported cases for countries and areas that have reported fewer than 5,000 cases. Most of these cases were imported, though some community transmission occurred, such as in New Zealand. After many months of seeing only imported cases in these countries, increase of community transmission and outbreaks have been observed in some of them, and this is also a reflection of improved response. If we look more closely at the countries, we can broadly categorize them into 4 groups. The first contains countries which cases are on the rise, such as Papua New Guinea and Philippines. The second contains countries in which cases came down and are again on the rise, such as Australia, Japan, and Vietnam. The third contains countries where community transmission has never been detected, so cases are only imported, such as Laos and Mongolia. And the fourth countries contained in which no cases have ever been reported, such as several Pacific Island countries and areas. Although those most vulnerable to severe disease and death tend to be older, the virus has impacted young people substantially, especially in the most recent period. For example, in the Philippines and in Victoria, Australia, more than half of the reported cases are people under 40 years. The same is true in Japan, where 65% of infections reported from July to August are among people aged 39 and below. This is particularly concerning as these age groups are more likely to have mild or even no symptoms, so they can transmit the virus in vulnerable settings such as aged care facilities and correctional facilities without knowing it. Thank you. Back to Dr. Kasai.
Thank you, Tamano. What we are observing is not simply a resurgence. We believe it's a signal that we've entered a new phase of the pandemic in the Asia Pacific. In this phase, countries are increasingly able to minimize large-scale disruptions to people's lives and economies by combining early detection and rapid response to emerging infections and people sticking to the prevention measures that are part of the new normal. The directions that epidemic now takes depends on the actions of government and people across the region. Over the past months, with experts from across the region, we have taken stock of the response, which has been guided by the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergency, or UPSET. We saw three lessons emerging. First, the significant investment in health emergency preparedness made over several years in the region have paid off. Countries have put to use the capacities and mechanisms built up over the years through upset implementations to respond quickly. This is one of the reasons why this region has comparatively low COVID-19 figures today. To prepare for the future, we need investment. Second, while countries have much stronger capacity than they would have otherwise had, the sheer size of this pandemic is greater than we had imagined and more than we had prepared for. And we realize that countries' preparedness and response capacity need to be scalable, so they can get much bigger or smaller and more targeted as needed. And third, we must continue to refine, learn, and adjust our response in pursuit of the new normal, because COVID-19 will likely be with us for the foreseeable future. Some of these refinements include a greater targeting and earlier introduction of localized movement control measures and public health interventions. Approaches like this could be more effective and minimize social disruptions and impact on economies. We also have to continue to strengthen the capacity of health system and public health to identify cases, isolate and treat them, and also trace and quarantine their contact. And now we must plan and act to protect the vulnerable. And most importantly, we have to continue encouraging everyone to maintain the behaviors that protect their health and that of their family members, colleagues, and community. As my colleague reported, the epidemic is changing. People in their 20s, 30s, and 40s are increasingly driving its spread. Many are unaware they're infected with very mild symptoms or none at all. This can result in them unknowingly passing on the virus to others. This increases the risk of spillovers to the most vulnerable, the elderly, the sick, people in long-term care, people who live in densely populated urban areas and underserved rural areas. We must redouble efforts to stop the virus from moving into vulnerable communities. We are encouraged to see many countries in this region already adopting new tactics that help minimize the social and economic consequences of COVID-19 and show how we can cope with it for the foreseeable future. Many are now detecting outbreaks earlier and responding to them faster with more targeted intervention and an agile approach that brings back health, societies, and economies at the same time. Where rapid detection is coupled with the robust contact tracing, clusters of infections are being controlled, even when those clusters are relatively big. We also recognize that many countries have increased their capacity of their health system so that they can accommodate more patients and avoid the systems being overwhelmed and triggering the need for radical measures. And finally, in many countries, we've seen impressive changes in people's behavior with mask wearing, physical distancing, and hand hygiene now part of daily life. We know it's not easy to keep this up, and that many people are tired. Well, we need people to continue making positive choices, protect themselves and their community. But change is fragile and sometimes short-lived. Achieving and sustaining the new normal everywhere will continue to be a serious challenge as long as the virus is circulating and we don't have immunity to it. But we can all make an active choice for a way of life that is safe and allow us to work and study. If we make these choices, we can use more moderate control measures, avoiding blanket nationwide lockdown, extreme economic closures, and high rates of infection and death, and find a way to improve both health and the economy together. COVID-19 is not just happening to us. After 7 months of pandemic, we're starting to see a way to restore health, societies, and economy together. We cannot do one without the other. COVID-19 will be with us for the foreseeable future. We know it's a long and difficult stretch, and we will face setbacks. But we must keep trying, learning, and doing it together. How we fare is up to each and every one of us. If we make the right choice every day, we'll come out of this as safe and as strong as possible. Thank you.